Thank you, Rick, for signing in. And Ruth, everybody else, there you go.
Much better than your whole day.
Agreed. New Mexico Senior Olympics, they lost their wheel. They forgot it at the moment. I know, they were. They give me the option. Mine didn't either on the tablet. All right, if you are in-house, please remember to sign in on the sheet. If you are a member, your name is on the list. If you're a visitor, you'll have to write your name in. On the back table is resource guides and various handouts that people have brought. And with that, it is now 12:01. And so we are going to go ahead and call this meeting to order. So welcome. This is our first month of the new layout. So we'll see how this works. Okay. So we're going to start with our membership. We started the fiscal year with 95 members. We are now up to 104. We got Rosie from Casa Kids, Teresa from Dr. Martinez's office, Elizabeth Road to Recovery, Yesenia, which her email is bouncing back to me. Your email is bouncing back to me. So it might, yeah, we'll get together on that one. Taylor Woodward for Anthony Bethany, Lorena Sanchez for Somos Una Pueblo Unido. I can do some of them. All right, so if you're here, welcome. The agenda, so I sent out a copy of the minutes and you have them also in your packet from last month. Did anybody have any changes that needed to be made? All right, there we go. All right, so nobody has said anything about needing changes, so we will move on from that. We'll assume it's correct. With that, we'll go to the Health Council activities. Shoot, we're gonna have lots of time. Dang it. All right, behavioral health and wellness, Elizabeth.
Good afternoon, everybody. Elizabeth Macias. I'll be giving an update on Behavioral Health and Wellness Committee. So the committee is focusing on a community needs assessment. Dan, I don't know if he's there in person. I don't see him on the thing. He worked on a survey and he completed a survey that was about 3 or 5 minutes long. And it covered behavioral health, like the emotional piece, mental health, substance use and addiction, and supports and resources. He provided this at the Health Expo. We'll go over the results at our next meeting, which is August 20th at 8 o'clock. We're wanting to create a strategic plan to move forward on addressing behavioral health needs of Chavez County. So I don't know, I can't see if Dan is there in person, if he wanted to speak a little on that.
He's not.
Okay, then we'll have more update for you guys at our next meeting.
Did we miss the meeting last month?
Nope.
Okay.
I think it's just a long month.
Could be, because I was panicking, thinking I forgot something.
No, you did not. We are good.
Okay, does
Thank you.
anybody have any questions for Elizabeth on behavioral health and wellness? All right, together with veterans,
Is she not on your anything?
she sends me those reports, but they don't do anything because she doesn't give me breakdowns.
Okay, together with veterans, we had a,
CPR training.
yeah, TPR training last month.
13, wasn't 13.
No, it was like about
8.
eight people that we trained in TPR last month. We're gonna have another one later in the fall. So Carrie will send out that information on the TPR training. Our next community team meeting is this Saturday at 11:30 at the American Legion Post 28 on Montana. Everybody is welcome to join. You don't have to be a veteran to join that. We're gonna be working on more planning of a stand down event. And what a stand down is it targets the homeless veteran population. So we're gonna try and tie the stand down into a pit count. So we're gonna be partnering with Dan. Dan's gonna work with us on training and getting volunteers to do a pit count. And that's a point in time, or point in time survey of the homeless unhoused people in our community. So we get a bunch of volunteers, they go out and they find where they are and ask a series of questions about their situation. And so we're gonna try and tie that into stand down because it's hitting the same target population.
I just want to say the issue with our point time survey, that we did last time was that we put a lot of resources into it and the state turned around and did not give us the data that we wanted to collect. So by doing this also, we're going to be able to capture, the data that we want to capture that will help us with potential funding, along with reporting to the state. But so we have a clearer picture. Our numbers were higher here than they were in Santa Fe, our last point in time, but they would not give a breakdown of the numbers.
Yeah, and that's kind of what we wanna use it for too, is we wanna be able to have that data to be able to use for other programs, not just together with veterans. I mean, we are gonna tie it with that and with our volunteers through that, but it'll be good information for everybody. And we will share.
What date did you say that was? Did you?
We haven't said, we can set a date, but after I had talked to Dan, I think we're gonna end up changing it. It's gonna be January or early February. Cause you know, they don't let you know ahead of time, so. He said last year it was towards the very end of January. And we had put a date in the middle of January, so we're gonna push it after our meeting on Saturday.
When do they usually release the dates on that count?
So it was a document, I mean, we could have had, if we had access to it, we could have had real life data as we were going, but they waited almost 9 months, 10 months to receive the data, and it was already time to do it again. And so we didn't do it this last year. So by partnering up, I think we will be able to do your picture of what we're experiencing.
I agree because they were really pushing like the last minute for Plaza to step up and try to assist with that, and it just really was no time to coordinate anything the last minute.
Yeah, it was like that last week. It's like, y'all need to do it. And it's like.
Yeah.
Yeah.
But when do they normally start making the announcement on when they're gonna?
Probably not, they start having meetings October-ish.
Okay.
But when we did it last, we probably started talking about it and organizing, a month prior to that. So probably in the next month or two, if we're serious about doing this, we need to get on it.
Yeah, cause we're gonna have to, cause if we're trying to find like showers, trailers and and some of the resources to actually help within the communities. I can't do that last minute. I have to get that scheduled out.
Right, and then putting together the blessing bags and everything.
Yeah.
As well.
Yeah, that's what our meeting on Saturday is gonna be. We're gonna delegate contacting organizations to be on board to help us with that and then have time to go over that.
And the last time we did it, we had a learning center and that helped. So we would need an area, if that be here where we can congregate, we make the bags and to coordinate and try to get as many volunteers as that we can. So it's a 1 week period that we capture where they slept for one night.
Just include both sheltered and unsheltered.
We capture both, but the state wants unsheltered, but because we're gonna be working together. We can come up with what data we want to collect also, on top of what the state wants. So we can ask other questions.
But we're trying all the services for us, so. I figured.
So, this Saturday, are you guys gonna talk about that, or is it gonna be the next meeting?
This Saturday, we're gonna start delegating to people to contact organizations to join. We're gonna pick another date.
Okay,
The stand down, the point in time can happen anytime before that. That's why I'm thinking it might be beginning of February.
okay. So if you're interested in helping with the stand down and doing this, the pit count and this piece to it, get with Jennifer. Let's see if you have time to attend the Saturday meeting this Saturday, if you're not part of the youth summit.
Yeah.
And then that way, and if you're not able to attend, get us your information, and we'll make sure to get you on the list so that you're part of the planning committee. Cause it's gonna take a lot of us to be able to put the resources and stuff together. Especially if you're already in a situation where you deal with the homeless. You'll have more access to information and resources and things that we don't necessarily know or think about.
Yeah, we really need to have the people that already deal with that population to join us and be part of it. And I know a lot of people are gonna be at the youth summit at the same time on Saturday. And the timing of it, we always have to work together with veterans meeting on the third Saturday of every month. But we'll have a steering committee meeting in September on the 27th, and anybody can join that, because that's pretty much all we're gonna be doing is stand down stuff and point in time survey.
All right, does anybody have any questions on Together with Veterans on the stand down or any of that? Okay, it's missing from, I'm gonna give Jennifer a little break here. It's missing from the agenda, so I'll let Geneva talk about ZAG, the youth event.
Yes, we are excited for the business fair, for our entrepreneurship fair, for our youth. We have, I think, 14 kids signed up. We have 6 spots left. The Eastern has come in at sponsoring $3,000, and then Richland today is cutting a check for $1,000. And then we had a $100 donation. So if anybody wants to be involved, we are looking for mentorship for our entrepreneurs. It's for ages 10 to 17. If they have a business idea, or if they don't even have a business idea, we can help them develop a plan. It's gonna be like a very glorified farmers market / arts and crafts fair. It will be held on October 25th. We were gonna do it at the Boys and Girls Club, but with the hospital coming in, with them being our biggest funder, they would like to do it there. We are asking the senior circle, some of those participants help. We have our first, and when I say help, we have on the 21st and on the 28th. The first part, they're gonna be building their business plan, so we need people that want to help them build their business plan. It'll be for 2 hours, from 5:30 to 7:30 at Senior Circle. And then the 28th is when the kids are actually gonna tell us their business pitches, kind of like Shark Tank. So, we're really excited for this. This is our pilot project of these 20 youth. And if we can get those filled, if I can get some word of mouth, I'm sure all of us have a niece, a nephew, a brother, sister, grandchild, whatever, that has had a idea of selling not just lemonade, but we have a kid that wanted to do a shoe cleaning business. We also have, we've got all these cute little ideas, but then we also have a 14-year-old Dash that can't get a job. And he wants to come up with a business plan so he can earn money for his child. So this is not just for, like we're really want to empower these kids, but we need mentors. So think about it. I have some flyers. If you know of any youth that want to be involved, get them signed up. So we're gonna close it at 20 minutes. Thank you. Any questions?
Pass me a flyer.
Yes. The QR code doesn't work. The QR code is no on there, but Harry has developed a Facebook that that has the links where to sign up.
Okay.
And I've been sharing too, so you can find it off my Facebook as well.
But this, if you follow this, it should get you there.
Yeah,
Okay.
the links are good. I can't drop anything in the chat because it's not my laptop, and so I didn't save it, but I can do an email out after the meeting with the ZAG information to the entire group. So with that being said, I will do that. What is today, Wednesday? I will send out an email tomorrow, so if you have any documentation that you want sent out to the membership, send it to me today. And then I will only do one email, so that way it's all together, and then maybe people will open them up. All right. With that, now we can go to the Health Expo. Yay, it's over.
So it was huge, bigger than we thought. There were so many people. Like, I could not believe the amount of people that were there. You were there, like, holy cow.
So was it more than typical?
Yeah.
Because at the convention center, I remember 2,000 being a number. No, this is the most ever attended.
This is the most ever, and we had to estimate on how many people, because we had no way of counting actual people that came, because there's 4 entrances into the mall, plus all the stores that have entrances to the mall. So it was impossible for us to keep count, but based on
How many bags we gave out, which was 1 per family, how many of the resource guides were given out. Because not everybody actually came up to the registration booth either, so we missed a whole bunch there. How many turned in stuff versus how many were handed out, because we tracked every piece of document that we brought in. So that way we could get counts from multiple places, and that's why there was tickets for backpacks and then tickets given for them to draw prizes. So that we could count those things against each other, and then we had a couple booths that were kind of our partners in it as well to capture their data. And so that way we could kind of figure out and guesstimate, because it's the only way to do it unless we do that whole, every 10 minutes go count a square. And well, there's no way.
no, if y'all saw me and Carrie, we were running around like chickens with our heads cut off. I put in like 20,000 steps that day.
Well, myself and Lori, we couldn't go walk around, that's how busy it was, but we gave out like 400, and we didn't take anything back into office.
Yeah, I know that's how it was for family services upstairs, Masa.
The majority of them
Nothing left.
were adults that picked up, because our kids, they didn't want confession socks or penny board, they wanted my band. But we went back to any, nothing. Never commented about it.
Kathy?
I want to say I've been to a bunch of events before, guys. That's one of the most well-organized events that I have been a vendor in. They did an outstanding job. That was really well.
After 7 years, I think we may have got it down.
Yeah. This is not the first wrench we've had thrown in the expo, because, you know, we did the first one and then the second one, it was COVID. So we had to completely rethink everything, weren't able to do any large events, so we did that virtual only, and then the year after that. It was hybrid, so it was a hybrid and it was outside, and Carrie and I were like, never again outside.
Oh, I said that after the first one.
Yeah. And, you know, past couple of years, we've been able to have the convention center, but now that's gone, probably for a while, if not ever. So it looks like the mall is probably our sweet spot, and that's where we're gonna be staying. So we had 68 vendors, 107 total booths. We donated 16 of those booths. We had 3 last minute cancellations. Our booth revenue was $1,216.50, including 2 late fees. This year we did a late fee for booths because we got tired of people turning in their stuff late. So it was like $50 plus $100 late fee.
And I still turned away 4 because I said I can't do anymore.
Yeah, we didn't have any more space. We did run out of space.
How about backpacks? Did y'all get rid of them all?
Oh, yeah, we could have used
Yeah,
more.
it's on, I don't know if everybody got the post event report that was over on the stand, but it has everything in there. So we gave out, just us, gave out 326 event bags, 352 resource guides, 276 backpacks were given out. This is the first time out the backpacks at the event. It had people wanting more. So usually we have at least some left over and we distribute those down to the schools in the valley. This year we had none left, like all that Melina brought and that the vendors brought were gone. And it was probably about an hour before the end of the event that we're in now. Yeah.
Jennifer, did y'all get a report back from Angie from the mall to see how the stores do? Like,
No,
Yeah.
that would be interesting to know if they.
most of them don't, I mean, for them to pull their numbers together, usually that fast is a little hard for stores.
Yeah.
I know Salsa is so busy selling sodas because.
Yeah.
We had
Yeah,
the
a lot of vendors were going for drinks and burritos and lunch and all that, so we know that La Salsa was busy. I don't know about Kids Kitchen. I hope that they got just as much business. But we had 49 behavioral health surveys done, 548 gun locks that were distributed. 5 children got vaccinations, 7 birth certificates were issued, 152 doses of Narcan were distributed. And we had 32 mammograms appointments scheduled. That's the most mammograms we've had to. I think last year we were at,
Last year it did 29.
so we've got more. We had a ton of volunteers this year, thank God, because we needed them. We had 19 volunteers that did 96 hours worth of volunteer work for us. And then Carrie's got our social media. We did a couple of billboards, we did some radio ads. Carrie and I always go on the Mike Winter show. But it was really good.
Well, I think your all's booth from Casa was amazing, your all's costumes, your outfits, and then you did Easter.
Yeah, the
Easter
Easter was amazing.
Yeah.
You guys come with the gorilla and the big tub of bananas, which I noticed was late in the day, or also the bananas all day.
They were so good too.
They were so good. So it was phenomenal. Kudos to you guys, really, truly, you guys. did a
But
phenomenal
Casa,
job.
to see all their, I mean, to go with the theme, it was so neat. I said, does that go with our Pac-Man shirts? And they said, no, different game.
Well, and so we're already planning, next year will be August 1st, so it's always that first Saturday in August. It'll be at the mall. It's gonna be the same theme, just because this is really good and fun. While we're at the mall, we might as well keep it the same thing. So, you know, you saw what everybody did on booths.
So
Step it up.
maybe if everybody goes with the theme next year, it'll be even better. And I know that everybody wanted the shirt. I wore mine today. Everybody wanted the shirts. The only way for you to get a shirt is to sign up for the run.
Or even not even just sign up, but just donate money for the run.
Yeah, you don't have to do the run, if you just want a shirt.
Oh, really? Oh.
Sign up, sign up for the run.
Take one
get
with
your
you.
shirt.
Yeah,
And
take
then
a
you
picture
donate
for
the money
girls.
to the Boys and Girls Club, cause every bit of money that comes in for the run goes directly to the Boys and Girls Club to support their programs.
Yeah.
And so it's not a bad thing to just sign up, pay, and get a free shirt out of it.
I wonder if they had any extra shirts left over that they could still.
They did
like
it,
to-
we wanted.
For a donate.
They ordered enough for the runners to.
For those that signed up before the dead, so there is a deadline as well.
Yeah, it's usually in the middle of July. I guess he's gotta have the numbers and the sizes so that it can be ordered and printed and all that for the expo. So just keep that in mind, that Carrie designs the shirts and she always does a phenomenal job on designing the shirts, and they're always fun. This year was extra fun. So,
Yeah, it came out way better than I thought it was going to.
Well, you guys did a great job, and I'm just gonna say this report is excellent, so that whoever put this report together, great information. I've seen 0 people put together after reports like this, and so this is excellent, thank you.
well, we always know what we want for data. So we try to put that out for our events, so.
And for me, it's capturing the stuff that we do, that we have to do our reporting for. And so, you know, if there's things that we need to capture more screenings, I would like to see more screenings in the expo, and cause I think that's important to capture that data so that we know, what we're doing inside the community. So going forward, like next year, if you're doing a screening, then make sure I can capture that data, cause I don't necessarily know what everybody does at their booth, because it's all based off of that form. And then whenever I transfer the data over, it says so-and-so's doing screening, so that's where I look at it, but, nobody says that they're doing screenings most of the time. It's just
I
info.
didn't see in the advertisement about the vaccine clinic that they were doing, and so maybe if we highlighted that as well, because that is hard for a lot of parents, especially our working parents, to be able to get to public health office 8 to 5, blah, blah, blah. And so if we were able to highlight that somehow, I think we'd get a lot more.
Well, it was in there
Yeah.
because of the only one mistake on everything I made is there was no Z in immunizations.
It was on the poster.
And it was enough for people to catch it and call me out on it.
I didn't catch it. I even looked at it. I didn't catch it, so.
And it may be our part that we need to do more to get it off from our angle and support, the health fair at the same time. But like, we can reach out to the schools, and so that the schools get the information to the parents, so that the parents know that that's gonna be a shot plan.
Well, and I talked with,
They had one the day before at the health office, because a lot of people went to go pick up their forms. So. We just gotta do extra work with it.
yeah, I forgot what I was gonna say. Yeah, okay. It was something good, but I'll keep it to myself.
Did anyone get glasses, do you know?
We had 28 free eyeglasses. She screened 20 children and 4 adults. Yeah, so we were able to capture that. Oh, I know what it was. So I talked with Cynthia from the school district, and because we had a whole lot of everybody doing their event the day before us, and then the resources, and people were just stretched thin because there was a lot going on that weekend. She's considering that we can partner together for next year, which would ease off some of that, which would be fantastic. Cause then we could just get the parents, everybody into a one-stop location. We could set it up so that way if they need the parent classes, that speaking engagement, we could set that up, which is some of the stuff that we've always tried to do, is try to condense and just kind of grow it all to one big event.
I know that, I'd spoken to somebody, one of the booth vendors, I think it was Weeds, and she was totally glazed over. She said, this is probably like my 8th event and I'm over it. She was just like, I can't do another event.
And that's what we've been trying to avoid. And Health Expo is trying to get everybody to come in to do one big, huge event for the whole community and everybody partner up, so everybody's not having to work extra on their own events, it's just one and done. And with us doing it right before school starts, you know, this is our seventh one, next year will be 8. If we know what we're doing and people can just piggyback onto our planning. And just promote it how they would promote their own event, but not have to do all the extra work.
Yeah.
Given the cost of too, cause theirs was like 4 days later. And they gave away bikes and all kinds of stuff too.
And it was hot.
Yeah, it was hot.
Yeah.
I heard a lot of vendors.
Their angle was a little bit different because
Yeah.
it's health. care.
Yeah, theirs, I think, comes from higher up, that they have to do their own event because it's for the health, something.
Healthcare week or
Yeah.
health center.
For health centers, so each year in August is the month that health centers such as La Casa, that's kind of like our month, to promote and make sure that like rural communities have health centers. And especially this year was a big deal because so many rural hospitals especially are kind of on that chopping block. You know, we've seen a couple of them through New Mexico that have already been shut down. So yes, La Casa probably will not be one that would, but we will always attend. We will support in that manner, but yeah, they will not do a separate one because they do one here, they do one in Portales and Clovis.
I think the only downside was the certain areas of the mall were hot. And hopefully they'll fix their ACs for next year.
We're hoping that they will,
For some
like,
reason. I was lucky.
yeah, it's one of those things of it's 100% out of our control, the same at the convention center, whenever the AC was out in the lobby area, like. We can't control that, the leadership would have been better because we were hot too.
Yeah, and you know, the stores are vacant, they don't repair the air conditioning in those vacant stores, but as they bring in more vendors or merchants, then they start putting air conditioning into those stores. So like with Spirit going in, that air conditioner probably should get fixed and maybe they'll open up early enough that we can draw that to cool down that area. Apparently the mall has had their air conditioning pillaged. So that's why they just won't repair it until somebody goes in.
Well, their air conditioning has been out for quite
Years.
a long time, and if there's a merchant in a space. Their own air conditioners above them, they are responsible for their own air conditioners, the mall is not, so if there's nobody in there, the mall's not gonna fix those.
Right.
Those spaces.
Yeah, so hopefully they start filling it in and there's more spaces. All right, anything else on the Health Expo? Otherwise, we're gonna move on.
Well, if they don't get fixed, just tell everybody, bring a fan. That way we're comfortable. Cause we had a fan and that was helping us.
And of course, we don't know what it's like because when we're there, there's not that many people. And
That's
so,
the thing, even when it's functioning well and air conditioners functioning well, you put 2,000 people in one area and you're good.
yeah,
And that was part of it, there was a lot of people, a lot of vendors, a lot of community members. A lot of people opening the door, closing the door, a lot of vendors propping the doors open, not closing them, that didn't help, so. There's a lot of factors that go into it, we do our best to make sure that it's an indoor and not 100 degrees outside and us outside. But we can't control that part,
And it's all good.
yeah.
It was good.
all right, so let me hide that. So we have Penny from Lifehouse, who I believe is going to do a presentation for us. And Blanca, I don't know who else on, I saw Penny on there.
Hi, we're both here.
Hello,
Can you hear us?
yes.
I don't see, is my camera on? I don't see it on my end that it's on, but,
Hang on, it's because I'm sharing.
oh, okay, okay. Okay, no, that's fine. Okay, so were you ready for us to get started?
Yep, whenever you're ready.
Okay, absolutely. So my name is Penny Morton. I am the regional director for Eddy County for Lifehouse.
And I'm Blanca Frias. I'm the Community Education Specialist for Lighthouse.
So thank you for having us. First off, it's an honor to always be able to speak about the resources that we offer at Lifehouse. It's something that we're very passionate about. And so first off, thank you for having us. It's an honor to be here. I will talk a little bit about some of the resources that we offer. I speak to kind of the inpatient resources, and then Blanca will speak a little bit more about what it looks like for outpatient. So at Lifehouse, we assist individuals in creating productive, life-fulfilling, healthy lifestyle through what we call whole life services. Kind of what that looks like is we want to be the one-stop shop where you can come to Lifehouse regardless if it's inpatient, outpatient, regardless if you're an adolescent, an adult, a veteran, whatever that looks like. We want to be able to help you focus on mental wellness, physical health, and also personal growth. And so we go through the journey with you. We walk side by side with you, whichever resource you utilize of ours. We stand side by side with you. We walk through your journey with you. We don't just, hey, this is what you need. We always pair you up with a peer or someone who, stays side by side with you. And so with that being said, that's kind of like our approach at Lifehouse. And I'll start with detox. So we offer a medically monitored detox. What that looks like is if you are using substances, it could be anywhere from a 3-day stay in detox or up to a 14-day. The average is about 7 to 10. And what this looks like, I mentioned, it's medically monitored, so it's a safe way to withdraw, as comfortable as possible. Detox is a different wing from everything else we have going on at Lifehouse. So it is a secure, safe, comfortable as possible while our clients are seeking detox. They are monitored by medical professionals. We have a director of nursing, excuse me. And so monitored physically, and their mental health continuously is monitored as well. Once they are successfully detoxed and the client is up to transition, they will graduate over to our residential treatment program. And that is a 30-day program, and it is for men and women. The men and women are housed differently. Men have their dorms here at Lifehouse at our main branch, and then the women are housed at a different location offsite. And those women, they can bring their children. No children obviously can come through their detox journey. But once they go over to residential, we're more than happy to bring their children along with the moms and have them stay. We have community, relations with the city, with the bus transportation. So if their child needs a, ride to school, we partner with the bus, make that happen. The city transit, they're also available to provide services for their children to get to school. Excuse me. So as I said, we have, different community partners that we make phone calls and make sure that we're being all inclusive with the children as well, while their parents seek the treatment that they need. So from a residential treatment program standpoint, this is, for substance use challenges. It's a safe environment, and it creates a healing environment for the client who's struggling with substance use. While they're in this transition, it's a 30-day program. They have a dedicated team. They are doing programming. We do life skills. They are able to attend church on Sunday. We just talk to them about, life skills and kind of how their personal life is going to have some growth with that. It also does include individual and group sessions for therapy. So these are kind of some of the programming that's required while they go through that journey. Once they graduate the 30-day program, excuse me, we offer sober living. Sober living is not a requirement. So if a client has a safe place to go home, maybe they're married and there's not any challenges there that they feel comfortable to go home to, and their substance use won't be challenged, they're welcome to go home. Or we have sober living. So what sober living is it is a transitional housing environment where we promote independence. We also have life skills such as Bible study, parenting classes, healthy living choices as far as how, dieting and things like that, finance classes, different life skills that help them to be successful once they're able to transition out of our sober living. Sober living is a 6-month commitment, and it just kind of depends. It could be 6 months, it could be a year, just kind of what works for them. Some clients are ready after 6 months, some need a little bit longer, but it is a 6-month commitment at minimal. We did just open up our 2 newest sober living homes. We had an open house for them, and so we were able to house 18 more women with their children. And so very passionate about, our inpatient resources. I can speak to kind of some of our outcomes from last year. We were able to serve 3,589 clients last year. And so that is an overall amount for all of our programs. So that includes detox, residential treatment, sober living, counseling, our casework and peer support. So that's just the overall number of clients that we served last year. And so very proud of, being able to connect and change some of the outcomes in our community. Right now we are in Eddy County, and then I'll let Blanca talk to you in just a second about what our outpatient looks like. We're currently in Eddy County now. We did purchase a Taos, Rio Taos. I always forget, I say it backwards, but in Taos, New Mexico. And so we did take ownership of that about a month ago. So pretty happy to have that presence in northern New Mexico. And then when we have Chavez in mind, we are hoping to have some presence there in Chavez. Our goal is to have the same presence that we have in Carlsbad. Now, obviously that won't happen right away. But we plan to have the same presence in Chavez County that we have now in Taos and in Carlsbad. So I will let Blanca talk to you a little bit about what our outpatient resources look like. Our outpatient has grown tremendously in the last year. And so Blanca will take over from here.
Yes, so I'll start with our outpatient counseling. So we do offer individual and group therapy options. And then our options are tailored and unique to the needs of each client, and they're available to all ages, from children all the way to elderly. We have our intensive outpatient. This offers support and therapy for those struggling with addiction, allows individuals to continue living at home and engaging in daily life, opposed to going to one of our sober livings if that's what they choose to do. We have our case managers. These are peer support as well. They help our individuals develop life skills and secure housing. They help them with the practical stuff, even looking for job trainings, any resources they need. Our case management will help them. We have our justice involved services. These are peer-led recovery classes in the Eddy County Detention Center. And inmates learn recovery skills and transition back to daily life. So they will have that support coming out of jail. We have our community response team. That's our response. It's 24/7 mobile crisis services across Eddy County. So if somebody's experiencing a mental health crisis, we'll get our team out there. We're also working with first responders. So they'll give us a call when they need us, and we'll support them. Instead of taking somebody that's experiencing a mental health challenge and is not really committing a crime to jail, then we go ahead and provide that professional care and support at Lifehouse. Do you want to add on to the crisis team?
So in terms of the crisis team, our approach here at Lifehouse is to meet the client where they're at. A lot of times, the client, needs help and wants help, but doesn't know how to ask for help, or doesn't have the confidence, or they're not comfortable to raise their hand and say, I need help. And so this is a way that they can call us and we come out to them. Our goal is to get, the client in these communities the resources they need, rather it be walk to our door, give us a call, or we come out to them. So this is another way that we want to be able to be resourceful for our community when they need it. And because they can think all day, you know, it could be at 10 o'clock at night and they are up to it. But if they wait until tomorrow, where we're able to get them through detox, we might have lost that opportunity. So this is another way that we can connect with them and get them through our doors with us coming to them.
So other outpatient services that we have is the 7 Challenge program. So this program helps individuals who are still using reduce their usage instead of going, if they're choosing not to go to detox or not, or they are not ready to quit the substance. This is a way where they're going to start working with the therapist to start reducing their usage. Other group therapies that we have for adolescents, this is for conflict resolution. And then also for conflict resolution, and give me a minute, they're new ones.
These are new courses that we are rolling out. It's effective this week for our clients. Again, we're committed to, you know, broadening, being broader and offering broader services for our clients. So we're getting familiar with this one as well as it's effective this week.
Yeah, so the conflict solutions for teens is a structured skill-based therapy group that builds emotion regulation, communication, and problem-solving skills. And then we also have a new group that is going to be for adolescents for substance use disorder. Other things that we offer are medication assisted treatment. Our medication assisted treatment, our MAC program, supports individuals with persistent substance use challenge through long-acting injectables and providing consistent care without daily dosing. And then the way that we support our community, so that's how we support the client, and the way that we support the community is by providing Family Empowerment Project, which this is for family members of those who are struggling with substance use. This is a way that we support families because substance use or mental health sometimes affects everybody. And then the way that we support our community members who are not our clients, but want them to be part of our vision and our mission, we provide mental health first aid classes. This certifies the individuals to recognize and respond to someone experiencing a mental health crisis or challenge. And then giving them the skills to have those conversations and guide them to appropriate professional help. We also have our assertive community treatment. This is our ACT team. This team works with individuals with serious mental illness diagnosis, for example, like schizophrenia. This team, so these clients get an entire team, which is composed of a nurse, their psychiatrists, psychologists, case managers, and their primary physician as well. So they get an entire team to keep that ongoing care for them, because sometimes they require assistance when taking medication, they won't take it. Our team will go out to their homes and give them the medication, put the charts. They work out in the community with them as well as in our facilities. Yep, those are all our services.
So primarily, you know, a lot of people might have the impression that we are just a substance use facility. So we want to make sure that we're out in the community, letting everyone know that we're your one-stop shop for inpatient, outpatient, substance use, mental health, counseling, so many resources that we are proud to offer throughout New Mexico. So yeah, we're just, you know, committed to our mission and vision and changing the outcomes in New Mexico. Just a couple of statistics to share with you. New Mexico has the highest alcohol-related death rate in the nation for the last 30 years. You know, that after you sit and think about that and let that soak in, that's you know, scary. And then 1 in every 5 deaths amongst New Mexican adults is caused by alcohol. So these are a lot of, you know, important statistics as to why we're committed, why we want to offer and keep expanding our services and the area that we service. And so doing our best on a daily basis. We're very passionate about it. If you have any community events or any businesses that will like for us to come out and chat to your staff, we do that now. We go out to a lot of the oil field companies. We do a lot of, speaking to the community. So if you see any opportunities, we're more than happy to come out and talk to anyone. Any questions or anything?
Let me ask a couple. Can we refer people from Chaves County down to Eddy County for you guys to see them?
Absolutely, anywhere in New Mexico. And so what we can do is we can send something out. As you were saying, if we have anything, I can tell you that on all of our business cards, every brochure that we offer, so on, I don't know if you can see my camera, but on all of our brochures, we have this QR code on the back of our all of our business cards. We have this handy. It's a QR code. Anyone can refer anyone. It takes about 2 to 3 minutes. Excuse me. All we need at minimum is patient name and phone number. I will say the entire form has to be populated. It does ask for insurance. If you don't have insurance, just put a 0. So it has to be populated, but we just need a client name and phone number. We have a team who is committed to looking at these referrals daily. We do call. If you don't want to say, that you were the source of referral, you can leave it blank, just populate it. We won't share that. If you want to just say, hey, I had my son had a friend over, he mentioned he's depressed, and then we'll take it from there. Or you don't even have to say that. We'll just, you kind of tell us what it is that you are referring him for, and we'll take it from there. You don't have to, put the reason of, who was the source of the referral. Excuse me. So we do take referrals, New Mexico and Texas. So yes, I can send that out. And like I said, on the back of all of our business cards, we try to make it as easy as possible, so that you can send a referral just within a minute or 2.
Okay, thank you. So one of the reasons that I included Lifehouse in this is because the county and the city is working on that opioid funds. And Lifehouse has been one of the presenters in all of the meetings that none of us have been included in. So I kind of felt that maybe we need to have a discussion to kind of see what they're doing. Because there is an RFP getting ready to go out from the county, I believe. And so they're looking at bringing in, and this is a huge possibility because right now I feel like that's where the city and the county is leaning is towards with them. So I figured since y'all are not in the know, it was time to get in the know. So you can see what was happening within the community. With that, I thank you guys. We still have a presentation from Alianza. So I am gonna go ahead and put this over to Jesse so that we can stay on schedule because they're in Eddy County, Kenya. We don't know if they're starting in Roswell yet. That is, we're waiting on the county to put their stuff together.
So I can tell you our goal is to have the same presence that we have, wherever we go. We want to be able to offer it wherever we go, because again, it's a resource out there for, the potential client. We've received a lot of calls. We work when we talk about crisis response team and because we have dispatchers that work 24 hours a day here at Lifehouse, and we partner with 988, as she mentioned. We partner with the PD, with the sheriff's office, with the fire department. And so we do get a lot of our calls from first responders. And so that's a way that, it could just be a car accident and someone passes away and the family needs support. We want to be able to get them connected with our therapists. So our goal is to have as much presence as we can. Obviously, it wouldn't happen overnight, but that's our goal.
All right. Thank you, guys.
You're welcome. Thank you.
Jesse, are you on?
I am. Hi, everyone. Jesse Hernandez with Alianza of New Mexico here. Can you hear me okay?
Yeah.
Okay. Is it possible for me to share my screen, Carrie?
Yes, you should be able to do it.
Okay. So I'm Jesse Hernandez. Let's see where we are. Are you all seeing our website, hopefully, our brand new website?
Yes.
Okay, so Alianza of New Mexico provides harm reduction services, housing services. We do medically assisted treatment navigation, so we actually work really closely with the team at Lifehouse and our other medically assisted treatment providers to help get folks into treatment from their harm reduction services. We provide free Narcan, and we do train folks on how to use it. So our brand new website has a list of all of the services that we provide. And today I wanted to share a little bit with you all about the harm reduction services and how folks can access free Narcan. So we can train any individual. We're open from 9 to 4:30, Monday through Friday. And we have a lot of harm reduction services and supplies that we're providing. So our goal is to always have a arms wide open, stigma-free response. We do HIV and syphilis testing, and we want to make sure that folks have somewhere safe that they can get information and stay safe and prevent overdoses. So we do provide syringe disposal and distribution, and we have safe use kits, including wound care, and we also include harm reduction services like sunscreen, right? One of the things that folks think about harm reduction services only as being syringe services, but actually hygiene items, sunscreen, water, things like that, and then immediate referrals and access to all of the services that the rest of the community provides is really the key. So we have our overdose prevention. We do have a form where you can access and request training. We have links to all of the videos that the Department of Health has put out on how to use Narcan and where to get it, the form to have it sent to your home if you ever need a refill. We also have an adulterant checking program, so we can actually make sure that things are not tainted with fentanyl. And then we have also all of our amazing 100% Chavez County data embedded into our website as well, so that folks can really take a look at what it is that's going on in the community and access all of these great services. One of the things that I wanted to highlight is that we do make sure that all of the folks that are accessing these services are receiving information about Never Use Alone. It's a little awkward because I'm presenting to you all who are in the room and having people raise their hand, but does anybody know about Never Use Alone? Is this a resource that folks are aware of at all? I can't see any hands going up, so I'm going to assume that that's a no. Oh, Geneva knows it. Was that Geneva's hand? So Never Use Alone is a national program to prevent overdoses for folks that might not be using in a social setting. So if there are folks that know that they're going to be using alone, they can call this 800 number and they can be connected to a trained volunteer who will stay on the phone with them and send EMS to their location if they become unresponsive. We do know that a lot of folks are facing a lot of judgment, stigma, and shame in their substance using, and so they might be hiding that substance use. So we do know from some of the fatality review boards that have happened in the state that even some of our overdose fatalities have happened in a home where there was someone else present, but that person was unaware that the person who passed away from the overdose was actually using substances. So this is one of the info cards, QR codes, phone numbers that we are giving out very consistently to help make sure that our harm reduction clients are able to stay safe. So I'll stop sharing. I know that we're a little bit further along in the agenda, so I went through that piece very quickly. I can drop the new website and the Never Use Alone information into the chat for everyone as well. We do also provide our housing services that include homeless prevention, where we can help prevent evictions, and rapid rehousing for folks who are experiencing homelessness. But I'll save that for another day when the topic is housing.
So, Jesse, what I'm gonna do is, let me see if I can take back over the share and open up the whiteboard. All right, online, can you guys see my whiteboard?
I can see it.
So now, like I said, we were gonna talk about mapping resources. And so like where Jesse was talking about, you could drop in the websites. So this is what we'll do. And I can capture this stuff and then I can send it out to the group. So that way we have a full list of the different resources. And one of the reasons for doing this is, I think it was this week, last week, I got a call from an aunt who has an 18-year-old niece who needed some behavioral health, some prevention services. And so I'm going through the resource guide. So, you know, she was looking for a facility where she could go and be kept, but it needed to be this, it needed to be that. And I don't necessarily know all of this stuff. I mean, I have things, but I need to figure out how I can make it work with what they're looking for. So to me, this is where mapping the resources come in handy. Take all the information and the knowledge you have and share it. Provide it. So with that, whatever you guys have, let's start mapping. Go ahead.
Okay, nobody mentioned Medmark Treatment Centers, methadone clinic. That's one, but
Right.
there's also another one, that is based in Seminole, Texas. They do accept Medicaid, New Mexico Medicaid. They will come and provide transportation for that person, and then they will take them to detox and allow them to stay on their medicated assisted treatment. No matter what it is, they'll be able to kind of, they will be able to give them that medication there and dispense it, whether it be Suboxone, methadone, whatever it may be. So that's also something I can send it in the chat.
Well, I can't see the chat, so what I wanna do is, so are we talking treatment and prevention?
Yes, that is treatment.
So we'll just drag, and you guys online, you can drag in here as well and add stuff. Where's my hand? Where's my hand?
11 years. Yeah, 11 years. There you go.
Okay, so who is it?
Okay, so there's Medmark Treatment Center.
Medmark's on here.
Okay, and then there's, New Visions at Seminole Hospital District.
SEIMNOLE.
Yes, ma'am. I have an address and a phone number.
Just give me a phone number.
Okay, 432-294-8862.
Right. Okay,
You did part two things.
it was 423 or 432.
432.
Some days I'm dyslexic.
Okay.
All right. What else we got? So, our categories, by the way, is kind of what is we have education, harm reduction, and then treatment and prevention. So under education, we got New Mexico Prevention, which has got newmexicoprevention.org, the 988 suicide crisis line. Youth Rising, I think falls into education, but I'm not 100% sure. Cassandra, if you're on, you can chime in and tell me if you belong there, if you need to be moved somewhere else.
Oh, I'm with Youth Rising, so I'll be
Oh.
prevention. I'm sorry, and I come from, most of you who know me.
So are you Cassandra? Okay.
I come from
I don't think
Medmark
I've-
Treatment Center, so, I just left there, but 6 years I worked there. And medicated assisted treatment, so it's a big, passion of mine. I advocated really hard for that population, still do, but, yeah. I'm with Youth Rising now.
Okay.
DOH, let's go to.
Yeah. Reproduction,
Yeah.
no,
So you know, where's the money?
no, the health office does, we started the MOUD. Yes, for the health office.
So, yeah, under harm reduction, I've got Alianza, Public Health Office with DOH. And then there's the website for, New Mexico harmreduction.org.
Yeah.
And then, the Health Council, we do naloxone training for groups. Whereas Alianza does one-on-one, we can come in and do an organization. Like we're trying to set up one with the hospitals before.
And then I believe Rocio's on, she can talk about the MOUD.
We're just needing, we're just mapping resources right now.
I think
did the public health office, I know Casa Kids does it, but you know, Chest Health is a whole online platform where it does prevention, intervention, and treatment. And so I thought that they were using the platform, and so you would just go and scan and you could do a quick screening, and then they would do recommendations for, you know, peer support, and all of these different layers, but it's called Chest Health.
So that would be under prevention?
It's kind of like a little bit of everything.
So Chest Health does not have a contract with the state any longer.
Oh, did it go away?
Yes.
Did we still have it at Casa Kids?
They're holding on.
They still have it at Midmark, sorry.
Yeah.
They're holding on for hope that regions may look to contract separately with them. They've already got a northern region contracted with separately, so they're letting those who are to stay active right now.
So those that are using it can still use it.
All right, so I'll put a question mark on that one.
Big Karen, you can also put the 1-833, the SW nurse hotline, because they will direct all over POH. So I have that too.
Okay, this is my first time using this whiteboard and it's pissing me off.
And they will get a nurse, you know, into the call number, a nurse comes on.
So that'll go under treatment as well. And that's the SW nurse.
Yes, it's 1-833-796-8773.
1-833-796-8733.
8773.
Okay. All right. Anybody else? Thank you.
Also, Pinwheel. They're close now. Are they still here? We use them so that we telehealth.
I'll ask right, psychiatric services also, there's medicated assisted, I think they were doing Suboxone.
You help?
I don't know about Kimball, I haven't talked to them for a while, but they were.
That's Nicole. That one keeps getting kicked back to me as not there.
Not sure she's still there. It's just her. Cause I think that there's still.
So maybe Pinwheel. I'll put a question mark. And then who else did you say? Azurite?
After psychiatric services, last I knew they had Dr. Nelson there, they probably the box.
Okay.
Renew Health, no.
Renew Health is on here.
Yeah, Renew Health is in there.
Okay. All right. With that, we're overtime at 1:07. So.
You gotta get off the whiteboard.
As we get off the way. Can you take it now?
Yeah.
All right, so we are going to do the gift card drawing. While she's doing that, our next meeting is September 10th for the membership. Behavioral Health and Wellness Committee is August 20th. The Together with Veterans meeting is this Saturday, August 16th. All those dates are on your sheet. We'll get this kind of organized and fixed a little bit better so it flows faster. This is the first one, so. Stephanie Gallegos, you are the winner of the $25 gift card. Are you in this room? I'm handing it to your mother. If she doesn't give it to you, she can take us both out for coffee. All right, with that being said, unless somebody has something pressing they need to say.
10 seconds.
10.
They do a scam, guys, for Medicare, if somebody calls, that you qualify to get Medicare or in-home care, or and they gather your information, and then they're signing them up for hospice. And they're using your numbers to bill the government for hospice care. So please tell people if they get qualified, get them to sign up for free in-home care, that it is a scam. because they're trying to get the information so they can bill Medicare for it for hospice. And they don't deserve it, or they're not on it. So,
Yeah.
That's the newest one, and I just got a notification from Medicare.gov, so.
Well, and if you have any flyers, information that needs to be sent out to the public, send it to me today, because I'll send it out tomorrow.
Thanks.
All right. With that, thank you guys. We will see you next month.
How do they go?